Good evening. Welcome to Live United. Living United, an opportunity to hear about all the great things here in the Monadnock region that make a difference in the lives of our citizens. Today I'm joined by David Tenney. Dave plays such a critical role here in our community. He is part of Monadnock Family Services, our local community health center, mental health center. And Dave, you're in a critical role, and I say that because you are the program director for Acute Care Services.
Correct.
And, we've seen over the last few years such changes in how we view mental health. More needs to be done around that, and we'll talk about that. Mm-hmm. But the other thing that we've encountered is there's been more really linking together the whole behavioral health piece and that aspect of substance abuse and linking it to the mental health issues that go on. And I know you want to talk about that. But first, let's talk about acute care and what it really is here in the Monadnock region.
Okay. Well, our acute care services department provides a safety net basically for all the community members in the Monadnock region. We have a 24/7 service as far as we're available by phone, 24 hours, 7 days a week. And we have office hours 8:30 to 5 every day, as well as we can see people in the emergency room after hours. So it's a full service. No other social service agency in town provides the comprehensive service that our agency does, but also our emergency services team is available round the clock.
And this could be for any mental health related crisis.
Right.
So it could be somebody's feeling suicidal, somebody's maybe depressed, somebody perhaps has shown up in one of our emergency rooms at the hospital,
right.
And you go in and do an assessment, I believe. And then your job is to really support them in finding service, receiving service either through Monadnock Family Services or connecting them to other services they're in need of.
Right. Part of what we do is referrals to a number of other community agencies and organizations. But we do, our main task is providing crisis evaluations for people in the most critical degree of stress or risk in the county or in the region. And so yes, it can be couples issues, individual anxiety, depression. It can be other difficulties with psychosis, for example, or suicidality.
You know, it's always interested me that people so oftentimes think of the extremes when they think of mental health. They think of the person who may be experiencing psychosis or the person who's making a suicide attempt. But really, mental health is so much more than that because we all experience it in our lives in terms of our own well-being. And we have stress in
That's
our
right.
lives.
Stress is a part of everybody's life, and we have to, each of us have to find ways of adapting to life's challenges and to find ways of coping when it gets more intense than other times.
And so you're really there when it becomes overwhelming for a person.
Right, right.
And whether that be they go into a depression or whatever the issue may be. So a critical role out there in the community. And my guess is that you've seen some pretty significant changes in the responsibilities attached to that as the unit at the Cheshire Medical Center was recently closed. So are you seeing an increased demand for service?
There's both an increased demand for services from individuals just because of life stresses and as well as the opioid epidemic that's been increasing the demand on services as well, because there's a lot more people that are needing to have referrals or evaluations or care around that. So there's more demand, but also there's fewer resources in terms of recently the mental health unit closed for the adults, and last year closed for children. And so these are two vital resources in this part of the state that are not available. So many people are ending up having to not having the same number of voluntary beds available, and then having sometimes to wait for a voluntary bed to be found.
And you know, what's frightening about that is, you know, people are in a place of not really being able to wait, oftentimes.
Right.
You know, you don't want a person who's in an opioid crisis and seeking help, or a person who's depressed and seeking help, not be able to receive that help they need. So what do you feel like, you're obviously addressing that directly. You know, you provide a service around that. But what, for our audience, what could they be doing that can support you in doing your job, but also the community in addressing this?
Okay. Well, I think on a large-scale basis, just there needs to be more money for social services in New Hampshire. That's just the starting point. There's a lack of money and a lack of services accordingly. So there needs to be more of a public call for adequately funded services throughout the state, particularly in substance abuse services area as well, and mental health in general. We depend on, our organization is a nonprofit, we depend on public support, particularly for my program, the Emergency Services Program, or Acute Care Services. We're not state funded. So we rely on the United Way and contributors to the United Way and other ways that people might donate. But yeah, I think in general, more of a call to our legislators and government officials to put mental health and substance abuse as a higher priority in our state, because well, I have a long-range view of emergency services and of mental health. I was the first emergency services clinician and full-time for Monadnock Famous Services in 1979. And so over those 37 years, I've seen a lot of changes. We used to do much more prevention work, helping people to be stable before helping people maintain their stability emotionally and head off crises whenever possible, and be able to hospitalize in advance when people are beginning to be in trouble. Now it's more a situation where there's limited hospital beds, and so sometimes it's more last minute when people are needing a hospital and meeting criteria of immediate risk to themselves. Then they can go into a hospital, but it's more difficult, and it takes time to find voluntary hospitals around the state who are also protecting their catchment areas. So it's not easy to do, but I have a good seasoned team, and we do our best to find a place within the soonest possible time after we have contact with someone. So that's it's not easy. There are fewer resources.
You know, and I come from the substance abuse prevention world, spent much of my career in that prior to coming to the United Way. And, I feel really strongly about that prevention piece that you're talking about. And when resources diminished for prevention here in New Hampshire, in so many ways, we probably created our own epidemic situations.
I agree.
And, I think part of the challenge out there to folks in our audience, and that both you and I experience, is we need you to be good advocates. We need you to reach out and to be talking to your legislators about this issue. As funding was cut for all of this, we began to see the opioid epidemic really emerge in a much more significant way, spice, all of these things. And that all affects mental health and well-being.
Oh, sure.
And at the same time, we were experiencing a recession. And, I get that you got to balance the budget and all those things, but sometimes we have to balance people's well-being with that budget.
And put that as a priority,
Absolutely, absolutely.
because we're playing catch-up at this point.
We are now, in particular, because we went through that period of 3 to 4 years where literally funding just diminished for these kinds of issues. Just a couple of years ago, we went through that experience. So now we're on the other end of trying to pick up the pieces of what was created as a result of that. So, there's some good things happening here in the Monadnock region. We need citizens to step up because we obviously have a shortage of emergency facilities with the closing of the hospital
Right.
facilities. We have a shortage statewide. We oftentimes have to send people to Massachusetts and Vermont.
Which our team does more than we used to.
Yep, for service, but they have waiting lists. So, that's one shout out to people to become advocates, to really get out there and to be speaking to this issue and to become informed, more importantly. And one of the opportunities to do that is the new system of care grant that the Monadnock region has received. And I know Monadnock Family Services, the United Way, the Cheshire County, the schools, multiple organizations have come together and really planned to look at how we look at our system of care related to mental health, particularly for our youngest population. So from early childhood all the way through age 24, they're really looking at developing this system of care and have come up with a plan around that, received $4 million recently to work on that. I have to say $1 million a year for the next 4 years and then sustaining that afterwards. With the significance of this issue, it sounds like a lot of money, but it's not a whole lot of money when you're talking about changing whole systems of how we work with people.
I'd agree. It's a good start, and I'm very glad to hear that it's in place and becoming available, and because it'll help improve the services that we currently have.
And it gets back to that prevention piece that you were talking about, because much of that is focused on how do we get to people before they reach that crisis situation. So, and it really involves, it's very youth and family driven, which is such a great piece of what's begun to happen in terms of how everyone works with people. They've made it much more centered on the family.
Right. And I think the children and youth is focusing on children and youth in particular are going to help in the long run in terms of as a preventive measure for for helping children and youth develop healthy lifestyles and patterns that will prevent them from having serious mental health issues in the future often.
So one of the things I wanted to talk about with you, Dave, because I'm sure you deal with this, is the stigma attached to mental health, and probably people even being open to your service. So what do you see out there related to that stigma, and what can we all be doing to really change that? I'm sitting here reading the what MFS, Monadnock Family Services, fosters, and I think it's important.
Yeah, we're mainly wanting to provide some hope and some foster emotional and behavioral well-being and whole well-being as much as possible. And I think that everyone over the course of one's life can go through different time periods where there are different crises. I mean, life is for learning and growing, and we, as we go through our life challenges, we will be tested and challenged at times. So learning how to develop good patterns of response to challenges in our lives and crises is important. And I think just in terms of stigma, doing our best to be less judgmental of other people for whatever reason. I think our culture is moving in that direction in general, but mental health issues are widespread, and everyone needs to treat everyone as a equal human being who has concerns and issues of different types.
You know, the thing that's always interested me is the stigma that's attached to counseling. That somehow it's viewed almost as a weakness. I hate to say that, but I think a lot of people view it as, if I need to go talk to someone, it's a bit of a weakness. So let's talk about the value
Okay.
of that, because there's a tremendous value, and as you just said, so many times in our lives, there's moments where life can just be overwhelming. It doesn't matter who you are.
Right, and some people have more support in place in terms of the family or a spouse or a friend, and others have less of that. So that's where the social services come in. But I would say that, on the other hand, from what you said, it takes a certain amount of courage to go into counseling and be upfront about what's going on in your life and what you're struggling with, and be able to take some courage with yourself to face what's going on internally in your own life, and to make the changes that need to be made to progress towards a healthier, more stable state of being. And so I would say there's the stigma that you mentioned, but it's not so much a sign of weakness. You need to have some courage to take those steps and to follow through with those steps afterwards, I would say, because anyone can go one time to a counselor and go out the door. But if you're really going to work in ways that are going to improve your life, it takes some follow-through and consistent effort, and you may have cycles of change over time, where you may be addressing the same or similar issues that you may have dealt with earlier in your life, but your counseling will facilitate your ability to recognize the patterns and to make changes when needed in the future.
So I want to talk about some of the different populations that you work with,
All right.
and some of what you're seeing with those populations. And I'm going to start because we just particularly honored some of our first responders, military, and things because of 9/11. What do you see within some of those populations? Are you seeing an increased demand for service? Are you seeing it pretty level? And can we be responsive the way we need to be?
Okay. Yes, I think we can be responsive. I think there's always room for more ability and services and resources and referral sites for that. But yes, I think there's a lot of people that are frontline providers who it's tough work, and you're going to be anyone with any sense of compassion who is in any helping service field, human services field, or an EMT or fireman or police that are working with humans going through struggle and crisis. You have to have a certain amount of compassion, and if you have compassion, you're going to be impacted personally by that to some degree. So yes, there can be post-traumatic stress disorder associated with those roles, and it's important for people in those roles to be aware that that's possible and to seek help when needed. So, yeah.
So, that's a sort of a one portion of our population, and then we have youth, which we were just talking about, and with this new grant, we'll be able to do a little bit more work with youth and the system that's in place. Hopefully, even integrating it through the pediatricians with doing assessments earlier in a child's life, in early childhood, to get a sense of what's going on socially and emotionally for them. Right. Kids experience trauma. And we experience trauma in different ways. It may be because of hunger. It may be because of abuse and neglect. It can be maybe you don't, you have financial stress in your family, and that can be very traumatic, they're finding now for children.
Sure.
And have long-term impact. That trauma has long-term impact on the brain and in their lives.
Yeah.
So that prevention piece you were talking about becomes critical. What are you doing for families that you really feel like it's important for the public to know?
Okay. Our agency as a whole, Monadnock Family Services, has a number of programs that help families. So there's individual counseling for children, there's family counseling, there's support groups, things of that nature, parent teaching, coaching. And then our program itself is, we will deal with any age group. But I would say increasingly we're seeing younger and younger children, partly because of the societal stresses that do exist. But we will try to work with the child and family as best as we can to give them supportive counseling and or hospitalization if need be when there's an imminent risk.
So I know that people always struggle with, when should I reach out on behalf of another person? And when I think of children, I think people struggle with that. It may be a family member seeing something. It may be somebody at a school. There's laws attached to reporting that if you think someone's at risk of hurting themselves or someone else, you have a responsibility, and it's actually a law, to report that. But what's just the right thing to do, and how do they do it? How do they reach out to you? How do they get the service that they need?
Okay. Well, we have a 24-hour phone service, first of all. And so anyone can call, and you can be confidential when you call to alert someone to a problem that's going on. Or you can call just to consult with one of our staff members in terms of how to proceed or how to evaluate when do I take this action or that action. So we're available not just to deal with someone in an immediate crisis, but also family, friends, other social service agencies, primary care physicians who have a concern about their patient. They can call us and set something up for some counseling. Even if someone is not ready for a hospital admission at a certain point, they can still see us in the office and do some preventive work to catch the crisis at an early point rather than having it go too far. So call us if you have questions. We're available to consult.
So I think your phone number and web address and things have come up on the screen while we've been talking.
Okay.
But it's really simple on mfs.org in terms of somebody with access to the internet. You can call Monadnock Family Services. You can call the United Way. And we will direct you to your services. People can also call 211. If you can't remember anything else, remember 211, because you can dial that and they will connect you to Monadnock Family Services, Acute Care Services. And I really want to highlight what Dave was just saying, because I think oftentimes we think of Acute Care Services stepping in when the person's already in crisis. Dave's talking about you can be really proactive. You, as a citizen out there, as a family member, as someone who cares about someone else, can really take the initiative and potentially reach out to Dave and his team and be able to get some advice about what those next steps can be and what you should be doing. So really important proactive work to be doing. Believe it or not, Dave, we're coming to the end of the show.
Okay.
So we got about maybe 30 seconds for any last thoughts you have for what you want to share with the community.
All right. Well, our program, our emergency services team does work proactively, as you say. If someone calls in, we can offer help to prevent a crisis from getting worse. We can also evaluate the degree of crisis when it happens and what needs to happen immediately to help people keep safe, to help people find resources that they need. It's not always easy to do so at this time, but we do our best as a team to link people up to protective services in terms of hospitalization and things like that if they need it, calling for voluntary placements as much as possible, or involuntary if there's no other option and someone's at risk or they're putting others at risk. So that can happen. And then we provide crisis stabilization services for after someone has passed through the most intense part of the crisis, then they still often need some assistance afterwards. And support to continue making the headway they've made, perhaps in the hospital.
So Dave, I want to thank you for joining us. And audience, I want to thank you for joining us tonight. And I want to remind you that it's programs like Acute Care Services that you can support out there in multiple ways, whether it's through the United Way, directly, however you choose to do that. But these are critical services in the Monadnock region. So I remind you, please remember to give, to advocate, and to volunteer. Thanks for being with us.